Hello, my friends. Thank you so much for tuning in. My name is Anne. Today, we are looking at the registration process for internationally educated nurses in the province of Nova Scotia. And guys, I think this is the easiest registration process so far. We are going to look at the residential process. We are going to look at eligibility, conditional license, as well as immigration and employment. Okay, so if it's your first time here, please feel much welcome and consider subscribing and liking and sharing this video with your loved ones, with your other nurses, other friends. Thank you for doing so. Okay, so Nova Scotia is one of the Atlantic provinces, and Nova Scotia also needs nurses. Okay, and so they have simplified their registration process. They have made it very easy, and they have 7 designated countries where they are sourcing their internationally educated nurses from, although they still allow other nurses from other countries around the globe to apply, but they have 7 designated countries for this registration process. Okay, so before you begin your application, there are a few things that you need to know and a few documents that you need to prepare, and I'm telling you, you have all this, like you have what it takes for this application. All right, so Nova Scotia has 2 registration pathways. Number 1, it has the expedited pathway, and that is for the 7 designated countries, and it has the traditional pathway. Okay, the traditional pathway is the normal pathway that has been there. So it's the pathway where they require you to go through NNAS, get your advisory report, get to do your NCLEX, and then get your license, or whichever decision they are going to make for that pathway. Okay, and now we have the expedited process, which is the one that I'm going to give you more details of what it's needed for you for this expedited process. Okay, so before you begin your application, they are encouraging you to participate in this survey, and that's the Nova Scotia International Community of Health Workers Engagement Survey, and this is just to help them to match you with your comprehensive immigration, your settlement, your employment, depending on your specific needs. So they are going to connect you with all these people depending on what you need, or depending with your unique situation. All right, so it's very, very good if you're going to register, or if you're going to participate in this survey. All right, so that's the number 1 thing that they're encouraging you to do. So the other thing they want you to do is for you to create a profile, and that profile for this expedited process, as I mentioned, it's for the 7 designated countries. Okay, and these countries are we have India, we have Philippines, we have Nigeria, we have UK, US, Australia, and New Zealand. Okay, so if you're a nurse from those countries, then this expedited process is for you. All right, so if you are not from those countries, then you're going to go for the traditional process. All right, so once you create a profile, you're going to choose your application type, because now they have to. So for you, you're going to choose the expedited countries. If you are doing the traditional, then you're going to choose the NNAS process. Okay, so once you create your profile, and then you're going to select your RN applicant expedited countries. All right, So once you have that in place, then you'll be required to submit your identification documents, all right? And this includes your passport, your citizenship ID. You can also use your driver's license if you have one, and especially for those people from Australia, from US, from New Zealand or UK, you can use your driver's license for your ID, okay? You can also be able to use your Nexus card, you know, your birth certificate, and if for any reason you have changed your name, maybe due to marriage, you can also submit your marriage certificate. And the best thing is that you don't need to notarize those documents. You can just send them the way they are. Once you send in your documents, then you are going the Nova Scotia College of Nurses, they are going to determine whether your license is in good standing, okay? So if your license has expired, please don't apply because your application is going to be rejected. So your license should be active and in good standing. And they have two ways of verifying that your license is in good standing and if it's active, okay? So number one, they can request you to provide a verification of registration form, and that is where your regulatory body back home is going to fill in that verification of registration form and send it directly to Nova Scotia College of Nurses. And also they can also request for your NNES advisory report, and that is for those people who had already done NNES. So if you have done NNES for any other province, you know, or even if you have done it for Nova Scotia, it doesn't matter, like you can port that report to Nova Scotia. And that is because already once your documents are sent to NNS is able to verify those documents. So if you have your advisory report, then you don't need to send any other verification. They are going to use your advisory report for that purpose, all right? But if you do not have the advisory report, then you're going to go for the verification of registration form, all right? So for those nurses from the US, UK, New Zealand, and probably Australia, they can be able to use the search tool in your regulatory website, and they can be able to search for your license and verify if it's in good standing, all right? Other thing that you need to do is to pay your application fees, because unless you pay your application fees, then they cannot be able to process your application. So once you create your profile, you submit all the documents needed, then you're going to pay for your application so that you can have your application going, okay? For those nurses who are educated in the UK, or Australia, they are going to require your school to send in information to confirm your theory and clinical instruction in medicine, surgery, obstetrics, pediatrics, mental health, and community health nursing, okay? Or they are going to request from your employer to confirm your experience in medicine, surgery, obstetrics, pediatrics, mental health, and community nursing. So you have that extra information that you're going to provide, okay? So once all that is done, then they are going to require an original of your criminal record check, okay? So they need the original copy of your criminal record check. Once all those documents are submitted, then they are going to review your application for licensure. there are few things for you to consider before you activate your license, and that is because you may be from outside Canada and probably you need to prepare a few things here and there, or maybe you are in Canada, you are ready to go, so your options are going to vary depending on your situation. Okay, so you are going to have 4 options for your conditional license. So number 1, you're going to have get a conditional license now and take the registration exam now. Okay, so your conditional license is valid for 12 months. All right, so when you get your conditional license, you are authorized to work in Nova Scotia, but remember, you will still need to do your entry exam, and that is NCLEX. So you have the 12 months to have done your NCLEX. If you have your conditional license, then you can be able to work as you prepare for your NCLEX. All right, so that is number 1 option. Number 2, you can get a conditional license now and take your NCLEX later, and that is for people who are not yet ready to sit for their NCLEX. So you can get your conditional license, continue working as you prepare for your NCLEX to sit for it later. Okay, number 3 option is to take the registration exam now and get a conditional license at a later date. So you can decide to challenge the NCLEX now, and then if everything goes well, then you do not need your conditional license because you're going to get your practice license. All right, or if you fail in your first attempt, you might decide, okay, let me prepare again, and then probably you need to work so that you can be able, as you prepare, so then you can go for option number 3, challenge the NCLEX and then get your conditional license if things doesn't go as planned. All right, and number 4, you can decide to do nothing right now and get your conditional license and take the registration exam at a later date. So you decide to do nothing right now and then probably get your license, conditional license, and take the exam later. So those are some of the options that you have. One of the major things that you need to think through when you're activating your conditional license is that your conditional license, once is activated, it's valid for 4 months, and then you need to renew it so that you can be able to go through the 12 months. All right, and for those people who are in Canada, their activation starts once you are eligible for that conditional license. Okay, so if you're in Canada, you need to get that license, get that job, start working as you prepare for your NCLEX. If you're outside of Canada, then you do not need to activate your license until you get to Canada. Okay, so because you will need to prepare for your immigration, and it can take a while, right? And obviously you will not be able to work if you're outside of Canada. So you need some time to be able to have things put together for you to be able to be in Canada and start working. So you need to, first of all, prepare for your immigration pathway, and then maybe activate your conditional license. So you do not need to activate your conditional license right away, otherwise it's going to expire before you get to Canada. So the best thing to do is to first of all deal with your immigration process, and once you land, then you can activate your license. And you only activate your license by paying the fee for that license. So if you do not pay that fee, then your license will remain unactivated. For those who are going to be doing their immigration, usually that eligibility for conditional license is enough for you to prove to the immigration officer that you have a license for Nova Scotia, and they can be able to process your immigration. Okay, so you may not need to activate that license for immigration unless the immigration officer requires to see that conditional license. Then that's the only time you can activate your license, but it doesn't really need to be activated, or they really do not require you to activate your license before you land in Canada. Okay, so those are a few things to consider before you activate your license. Okay, the other thing you need to know is that before you start working, you're going to review your jurisprudence for your registration. So you're going to require to do your jurisprudence before you start your work for the RN registration. So next we're going to look at the employment and immigration. There are some information that may be very helpful to you. For your immigration, usually they will require you to have a job offer so that you can start your immigration process, which is easier because you get your once you get your letter, your letter, what do you call it? Once you get your offer letter, then you can use it for your provincial nomination, and then you can be able to apply for your immigration or your permanent residence, and then be able to immigrate to Canada. All right, so being eligible for a conditional license, just as I mentioned earlier, is enough for your immigration to grant you a work permit when you get a job. So if you are eligible for your conditional license, then they can be able to issue you with a work permit once you find a job, and then as you process your permanent residency. And remember, the survey that you're going to participate in, they are going to connect you with the employers in Nova Scotia, and then you can be able to get a job. And I'm telling you guys, they need nurses, so I am pretty sure that you'll be able to get a job. All right, so for the employment, they have all the resources that you need for your job hunting. So you can be able to apply to Nova Scotia Health, you can apply to Job Bank Canada, you can also apply to IWK Health Center, or you can also apply to Nova Scotia Works. Those are some of the websites where you can be able to find a job. You can also find a job in the Health Association of Nova Scotia, Continuing Care Recruitment Health Association Nova Scotia. So you can be able to find those jobs in those websites, and I'm going to leave all the links in the description box for you to be able to check them out and see all the job listing they have in their website, and see if by the time you are getting your conditional license, if you can be able to apply and get a job from those websites. All right, guys, those are some of the information that you need just for that conditional license, guys. Like, just that is what you need, and then you get your conditional license, be able to work for 1 year, and then as you prepare for your NCLEX. I think that's the easiest and the simplest process ever. Okay, so if you are from one of the designated countries, I think then you got your match. Nova Scotia is the best way to go. Like, the requirements are very, very minimal. All right, I am going to prepare another video and take you step by step on how you are going to apply. Okay, so watch out for that video of the step by step. See you in our next video.